Just looking at the latest report that you've put out, the last time famine was confirmed in Sudan was 2017. Are the levels anywhere closer to what we saw then?
Thank you so much. The situation in South Sudan currently is quite dire. And what I can say is that we do not have famine in South Sudan currently. What we see is that a high population is food insecure, and with 7.7 million people who cannot access enough food for them to meet their basic needs. We are also seeing that high numbers of children with acute malnutrition, 2.3 million. This is up from 2.1 million that we had projected at the beginning of the year. This means about 10% increase in the number of children with acute malnutrition. And what is also more worrying is that over 700,000 of those children are at high risk of death because of severe acute malnutrition. And actually, for this type of children with at risk of severe acute malnutrition are 12 times at risk of dying. So it's quite worrying, but we are not. We cannot say that we are famine for South Sudan at the moment.
Okay, so there is no famine, and not to minimize it, but just to get a clearer idea. So the levels that we saw in 2017 and what we're seeing now, your report says that 11 of the 13 counties are now facing emergency levels of hunger. What did it take to reach that point in 2017?
Yeah, so if for you to reach these levels of hunger or high levels of acute malnutrition, it's driven by many factors. As you know, we have had number of recurrent conflicts in the country, and when these recurrent conflicts do happen, what it means is that population is displaced. That means they are not able to access their livelihood as they should. They are not also able to have access, for example, the services, and they are most likely in IDP or congested spaces where they are not able to just live a normal life. So this is one of the big factor. Another factor is that we've had recurrent floods in South Sudan. So with the floods, it means, again, populations are displaced. They are not able to live a normal life. They are not able to access their normal livelihood, and also services, basic health and nutrition services, for example, with the displacement. And we know that for example, with some of the outbreaks of diseases like the current cholera or even malaria, early detection is critical. And once you detect and be able to treat people, then we can also be able to prevent malnutrition by doing so. So a number of factors. Also, in the recent past, we've seen also the impact of economic crisis, with the inflation, and therefore making more and more families not able to access enough food for them to meet their basic needs. So quite a number of factors, drivers actually, as we call them, that are driving up the food insecurity, as well as also the high levels of acute malnutrition. And just to say, for example, in South Sudan, only less than 2% of the children, young children, are accessing enough food for them to grow and develop well, which is very, 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 very low. Unless there's concerted effort really to improve the quality of diets that the young children are accessing in South Sudan, will continue to see these high levels of malnutrition.
And where does the food come from? Is it from aid donation, or is it because, as you say, other parts of the country have seen improvement when it comes to food security classification?
Yeah. Yes, the food comes from multiple sources. We have, of course, quite a number of, various types of livelihoods that are present in South Sudan. So we have those who are on the riverine, who are doing fishing. We also have food from farmers, people growing the food. We also have those in urban areas, like, for example, in Juba, where we are, where they buy from the market. And of course, for those who are displaced, or, for example, the refugee and the displaced population who depend also on aid. So there are multiple sources of food. But we see that most of the time, this food doesn't necessarily, in some of the areas where it's food insecure, that also the children are more affected because they are not getting enough to eat. So even if the population is getting enough to eat, the children are not necessarily getting the diverse diet that they require for them to grow and develop well. And for the children, this is what they need when they're young, to get enough nutrients for them to be able to grow and develop well.
You say humanitarian access in conflict situations is difficult, and that is understandable. But I just want to juxtapose this with another aid agency, a non-governmental organization, that was just saying that, UN assistance on the ground, particularly in Sudan, is also very bare or scarce. Is it because of the conflict, or are there other reasons why? Because we know that ODA cuts are also affecting UN resources.
Just maybe speaking about, for example, the nutrition services in South Sudan today, services for nutrition are 100% dependent on external support. Very limited or absent domestic investment in the provision of nutrition services. So, of course, when we see changes in the funding landscape globally, and even in the humanitarian sector in South Sudan, it also impacts the provision of services in South Sudan. And we've seen that actually some of the health and nutrition sites are closing down because there is no enough resources to be able to go around and reach all the children who are malnourished. One of the things is that in South Sudan, the cost of treatment for children with malnutrition is quite high because of infrastructure, maybe because of also the fact that the infrastructure is not as developed. And because of this, the cost of treatment is quite high. It's at $200 per child. So if you have, for example, 700,000 children who are severely malnourished, then it means that you need quite a lot of money to be able to reach all the children. So with the changing funding landscape and reducing funding, especially to the humanitarian sector, is impacting the provision of services in South Sudan.
Okay. So just a final question. How much, obviously, as you say, conflict destroys so many other things, including the infrastructure of access to markets, therefore causing food prices to spiral out of control. Is this also partly what is affecting external donations, or you say support that you would need? How is it affecting your abilities to help those without?
Say that again. I did not hear the question.
Okay, sorry. It's because you were nodding, so I thought you were hearing me and in agreement. So I was saying, you were saying the infrastructure that is destroyed includes that of the markets, and that naturally sends food prices spiraling out of reach, particularly for those you're trying to help. I'm saying, does that also affect you, as the UN agency's ability to source more food, more resources to for those who are in need?
Yeah. Yes, it does have impact, and more importantly, the impact is actually in making sure that the resources or the supplies that we already have in country can reach those who need it the most. For example, at the moment, we have some of the supplies that we have either here in Juba or in different locations that we cannot be able to move to where the population require it because of access issues. So it's affecting our ability in terms of reaching the children and the women who need it most in those particular locations. And this is really more heightened in the areas that are conflict affected, where we are not able to reach with the much needed health and nutrition services. So yes, it does have impact, especially in terms of making sure that those much needed supplies reach the children and the women that require it in those geographical areas.
Well, Ruth Situma, thank you so much for your time, and we wish you all the best in your mission. Ruth Situma is Chief of Nutrition for UNICEF South Sudan, sharing some insights on the growing nutrition crisis there. It is 29 minutes past 9.